here, especially those of you who traveled a great distance and those of you who had to make a return trip because of our technical difficulties the last time we tried to conduct this hearing. So thank you to all, and I want to thank the ranking member and his team as well for working with us on rescheduling this hearing. We know that there are more than 5 million older adults in the United States who do not have the affordable and healthy food that they need. We also know that 1 in 4 grandparent-headed households experiences food insecurity. I think we'd all agree that it is unacceptable that any senior is going hungry. Many older adults face preventable barriers to accessing the food that they need to remain healthy and independent. Some older adults may be unable to drive, for example, and need accessible transportation to go to the grocery store. Often, or I should say others, may benefit from a streamlined enrollment processes or extended certification periods. Most older adults are living with chronic conditions and need the option to include fruits and vegetables as part of their meals. Thankfully, addressing hunger is an issue of longstanding bipartisan interest and action in this committee, the Special Committee on Aging. We continue this tradition with today's hearing by introducing, with Ranking Member Scott, the Bipartisan Senior Nutrition Task Force Act, Senate Bill 5096, which will establish an interagency task force to address hunger among older adults and adults with disabilities. We're also releasing the committee's annual bipartisan report in both English and Spanish, recognizing the positive impact of 50 years of funding to support the Older Americans Act nutrition program. So this is the report, our bipartisan report, and this is the Spanish version that we're releasing today. Both, of course, are available on the Aging Committee's website. We know that that's now 50 years of bipartisan, not just support, but investment to ensure that older adults have the food that they need to remain both healthy and independent. With the report, the committee is releasing state-level fact sheets highlighting the outcomes of the Older Americans Act nutrition program for each state, represented by the members of our committee. In my home state of Pennsylvania, more than 9.4 million meals are served to older adults each year in congregate settings and through home-delivered services. Earlier this year, I had the opportunity to visit with Linda Ellison from Montgomery County, Pennsylvania, who referred to her local Meals on Wheels program as the Miracle on the Way program. That's because the Older Americans Act nutrition program provides meals and helps older adults remain connected to their communities. I believe we can, however, further help older adults who need nutritious foods. Seniors like Barbara Meisick from Luzerne County in my home state of Pennsylvania, right up in northeastern Pennsylvania, who tells us that, quote, it's hard keeping a diet that's good for our health because that food can be expensive. We know that less than half of older eligible adults are enrolled in the Supplemental Nutrition Assistance Program we know as SNAP, which can help seniors put healthy food on the table and stretch their incomes. We also know that many older adults and adults with disabilities, like Elaine Masters, who's with us today testifying, she traveled from Allegheny County, Pennsylvania, which is where Pittsburgh is, so you get the sense of the distance, that many older adults may struggle to access the benefits that they're eligible for due to preventable barriers in their lives. So I look forward to working with Democrats and Republicans to invest in and increase access to essential nutrition programs for older adults. The White House Conference on Hunger, Nutrition, and Health held earlier this fall laid out a framework to support nutrition across the lifespan. Senator Braun, a member of this committee, worked in a bipartisan manner to help make that conference happen. So together we can address senior hunger in the United States and provide older adults with meaningful opportunities for connection. And with that, I turn to the Ranking Member Scott.
Thank you, Mr. Chairman. Thank you for rescheduling this hearing. Thank you to the experts and witnesses for being here with us, both in person as well as virtually. I can't think of a more important issue for us to discuss in the Aging Committee than making sure that our seniors have as much food as possible, that they are healthy, that they understand and appreciate how much we love them. And I think that our work together on a bipartisan fashion to continue the 50-year tradition as it relates to publishing in both in Spanish and English, the recognizing the nation's first nutrition program for older adults. I'd also like to thank you, Chairman Casey, for working with me to introduce the Senior Nutrition Task Force Act, which will improve coordination. Think about it, in South Carolina, we have 25,000 seniors who receive nearly 3 million meals a year. It's amazing, the number of folks across this country who need food sufficiency. I'm thankful that we live in a nation and live in states where we have nonprofit organizations that are dedicated to the task, that they're up for the challenge, that they continue to respond. And I think about one person specifically in South Carolina, Charleston, a Vietnam veteran, spent 25 years defending our country, and he found himself diagnosed with stage 4 lung cancer and dementia. Neighbors drove his wife to the grocery store until COVID-19 hit, shutting everything down. When she called for help, they were starving, scared, and extremely depressed. The agency brought emergency food from the food pantry and connected with the Low Country Street Grocery to receive a weekly delivery of fresh produce and eggs. The couple began receiving home deliveries in July of 2020. While the veteran has since passed away, his widow continues to receive these much needed meals and is so grateful for the response. These services are so important for many older adults, especially when prices of everyday necessities continue to rise. 3 out of 4 older adults report rising grocery prices have negatively affected their bottom lines, their ability to take care of themselves. About 1/3 are eating less healthy because of inflation. Grocery prices are up 12% since last year, a 40-year high almost. Think about this. Cost of eggs have increased 49%, butter 27%, bread 16%, milk and frozen fruits, vegetables 15%, chicken 12%. Food pantries in South Carolina report a greater number of older Americans who need food than a year ago when we were still in the pandemic. Some older Americans healthy enough to drive to the food pantries say the cost of gas is up about 30% over the last 2 years, is actually causing them to go less often. So even when the food is available often because they can't afford the gas to get there. Farmers, including many senior family farmers, are also feeling the pinch. When the prices rise, we all pay more. Higher interest rates makes their work even more difficult. In December 2021, I wrote Ag Secretary Vilsack asking what the U.S. Department of Ag intended to do to protect Americans from the rising prices. His reply failed to answer the question. Last December, I joined my colleagues, including Senators Braun and other federal financial regulators, to provide farm lenders with regulatory flexibility to work with their clients so that we would have a better situation for all Americans. Despite more government funding than ever, food banks are buying fewer commodities because the prices are so high. The nutrition program benefits many vulnerable older Americans. We need lower prices and a strong economy to make this program as effective as possible. I hope this committee can maintain a balanced approach to securing good nutrition for older Americans. I look forward to hearing from our witnesses today, and thank you very much, Chairman, for rescheduling this committee.
Ranking Member Scott, thanks very much. And I'll start now with our witness introductions. Our first witness is Jeremy Everett. Jeremy Everett is the founder and executive director of the Baylor Collaborative on Hunger and Poverty. He's also an affiliate of Temple University's Hope Center for College, Community, and Justice, which works to ensure students in Philadelphia and across the country can meet their basic needs. Additionally, he was appointed by the United States Congress to serve on the National Commission on Hunger. Our second witness is Dr. Walker, the Senior Hunger and Nutrition Coordinator for the Georgia Department of Human Services. Dr. Walker leads the implementation of the Georgia State Plan to address senior hunger, the first of its kind in the state. Dr. Walker will share her experiences with an innovative approach the state of Georgia is taking to reduce food insecurity among older adults. Doctor, we want to thank you for being here today and on the prior day, and for making the effort you made to be here twice for our hearing. Our third witness will be introduced by Ranking Member Scott.
Thank you, Mr. Chairman. It's my pleasure to introduce Tom Gilroy. He's an 18-year resident of South Carolina. He and his wife, Marilyn, wanted to spend more time closer to the grandparents and giving back to their community. They previously volunteered in developing countries on nutrition, education, and housing projects, and now focus on helping people in the community in the Charleston area. They discovered East Cooper Community Outreach, or as we call it, ECHO, a community-based organization founded in the aftermath of Hurricane Hugo back in 1989. Tom and Marilyn are part of a team of over 300 volunteers who make ECHO so vital to our community. Tom volunteers at ECHO's food pantry, where he interacts with clients from all walks of life. Many of them never expected to need ECHO's assistance. They are grateful for Tom, Marilyn, and all the volunteers and staff at ECHO. Tom, we appreciate you taking the time to share your experience with us and raising awareness of how important volunteers and community-based organizations are to among seniors. Thank you for being here with us today, and we look forward to hearing your testimony.
Thank you, Ranking Member Scott. And our fourth witness is Elaine Masters from Gibsonia, Pennsylvania, Allegheny County, as I mentioned. Elaine is a nutrition advocate who recently was a representative at the White House Conference on Hunger, Nutrition, and Health, where she shared her experiences navigating food insecurity as both an older adult and a person with an invisible disability. Elaine will share her experience as a participant in federal nutrition programs. And Elaine, we want to thank you again for being here and making that trip. And I heard about the early train you took, I guess, yesterday, right? But thanks very much. So we'll start with our first witness statement. And I'll ask our witnesses to try to stay within the 5 minutes. Obviously, if you go 20 seconds over, we're not going to use the gavel. But obviously, if you get into the minute and a half, one of us will grab this gavel probably. But thanks very much. We'll start with Mr. Everett.
Chairman Casey, Ranking Member Scott, and distinguished committee members and staff members who made today possible, thank you for providing us the opportunity to engage with an issue that has far-reaching implications for our neighbors facing barriers associated with aging and disability status. My name is Jeremy Everett, and I serve as the Executive Director of the Baylor University Collaborative on Hunger and Poverty. Our mission is to cultivate scalable solutions to end hunger. We do so through multi-sectoral collaboration, increasing access to public programs, and testing specialized interventions for populations disproportionately experiencing food insecurity. My testimony centers on a challenge with solutions rooted in our mission. These solutions build on an investment of more than half a century of tested interventions provided for in the Older Americans Act and opportunities provided for in the Farm Bill. They also open the door for interagency collaboration that more comprehensively supports the nutritional needs of older adults and adults with disabilities. According to the Urban Institute, since 2002, the number of older Americans has increased by almost 20 million, from 12.4% to 16.3% of our total population. Over 5 million older adults suffer from food insecurity. Additionally, data from the Department of Health and Human Services reveals that disability status, regardless of age, is the primary indicator of food insecurity at the household level. Neither aging nor disability inherently make one predisposed to food insecurity. Instead, structural barriers like transportation access, siloed programming, and resources have not kept pace with the demand. Our call to love our neighbors as ourselves compels us to identify and remove those barriers. The pandemic and its economic consequences have exacerbated challenges faced by this population to accessing adequate, nutritious food. We know that one of these challenges is that food and fuel prices are higher, but paychecks for those on fixed incomes are not rising proportionately. To combat this, I suggest 3 solutions. The first are to cultivate coalitions and interagency cooperation. Our core assumption at the Baylor Collaborative is that no one organization or sector can end hunger alone, a sentiment echoed at the White House Hunger Summit. The only plausible pathway forward to ending hunger in America is to create and sustain intergovernmental and multi-sectoral collaborations. So Chairman Casey and Ranking Member Scott, the Senior Nutrition Task Force Act will go a long way to ensuring that eligible older adults and adults with disabilities are enrolled in federal nutrition programs. The second solution is SNAP accessibility. Less than half of eligible adults ages 60 to 69 participate in SNAP, the most effective intervention we have at strengthening food security. Yet many older and disabled adults find the program to be inaccessible. Pandemic initiatives such as outreach, automatic enrollment, automatic recertification helped overcome these barriers associated with living on a fixed income. Making these initiatives permanent can vastly improve food security for millions of Americans, as well as promote a more streamlined approach that will contribute to the efficiency of running the program. The third is our specialized interventions. The pandemic helped demonstrate with additional funding and support, programs can more innovatively address food insecurity in their communities. Many congregate meal programs began to offer meals in parks or partner with local restaurants. When you combine innovation with research, we are better able to accurately identify the problems of food insecurity and thus create interventions that can radically improve nutrition access. The best way you can do this is to utilize key legislation to promote and expand pilot projects. We often forget that senior congregate meal programs and home-delivered meals through Meals on Wheels were once pilots that were proven to be incredibly successful interventions and scaled through the 5 decades of the Older Americans Act. Now we need to continue to invest in these vital interventions while testing out new ways to improve adequate access to nutritious food. This is a winning issue for all of you. Strengthening food security for Americans is doable and continues to be one issue that people across ideological divides unite over. Political colors of red, blue, and purple fade into the background when it comes to figuring out how to ensure proper nutrition for the most vulnerable. They disappear altogether when we talk about doing so for older and disabled adults. Thank you.
Mr. Everett, thanks very much for your testimony. Our next witness is Dr. Temitope Walker, and we appreciate her testimony and her return here.
Chairman Casey, Ranking Member Scott, and members of the committee, thank you for holding this hearing today. I'm honored to provide my testimony about some of the tremendous work occurring across Georgia to address senior hunger. I have over a decade of experience in evaluating, addressing, and raising awareness about the holistic needs of older adults. I came to my current role having obtained my doctorate in foods and nutrition and a graduate certificate in gerontology from the University of Georgia. My dissertation project, titled The Impact of SNAP Participation on Food Purchasing Practices, Diet Quality, and Food Insecurity Among Low-Income Older Adults, exposed me to the impact of critical support services and resources available to seniors. I currently serve as Georgia's first Senior Hunger and Nutrition Coordinator, as was stated. I manage the implementation of Georgia's first of its kind standalone state plan to address senior hunger that was implemented in December 2017. As a subject matter expert in senior hunger, I work with many different partners, including 12 senior hunger coalitions, which are housed within our 12 area agencies on aging to help provide training, raise awareness, and leverage state policies and initiatives to improve the food security of older Georgians. Our area agencies on aging coordinate the delivery of Older Americans Act services. Our division oversees non-Medicaid home and community-based services that help older Georgians, their caregivers, live safe, healthy, and independent lives in their homes and communities. In 2020 and 2021, the division received an additional $44 million in stimulus funding from the Consolidated Appropriations Act and the American Rescue Plan Act for home and community-based services and to promote vaccine access. This funding also included $25 million for meals and $17.5 million for supportive services. Many of the additional services provided were made possible through this supplemental funding. Georgia is home to over 2 million older adults, accounting for 20% of the state's population. The division serves meals to just over 30,000 individuals through the Older Americans Act Nutrition Program. Georgia has a high level of diversity among our older adults that is reflected in race, ethnicity, culture, and cuisine. Accepting this diversity as an opportunity, Georgia continues to serve as a model in best practices and in proper leveraging of partners across different sectors. Though we do have high rates of food insecurity among our division meal recipients, these rates have been steadily declining. We are meeting our charge to target those in greatest economic and social need. The story of seniors in Georgia and across the nation is really about the factors that impact their lives. It's working, receiving Social Security benefits or no income at all. It's owning or renting a home or homelessness. It's living alone or living with multiple generations under one roof. It's choosing which utility bills to pay first or whether to buy some or all of their medicine. It's being a caregiver for their parents, children, grandchildren, or other relatives. It's finding the next food box giveaway or local pantry options. It's trying to find or maintain transportation for food, health, and connecting to others. It's their faith. It's the love of pets and taking care of them. It's adjusting to a place they didn't grow up in and navigating in different languages. It's resilience of decades of getting by to make ends meet. The Older Americans Act Nutrition Program and the Farm Bill programs such as SNAP, the Senior Farmers Market Nutrition Program, and the Commodity Supplemental Food Program play critical roles in addressing food insecurity for older adults. It is fitting that the committee is recognizing 50 years of the Older Americans Act Nutrition Program, which has been a critical support for our seniors. Georgia State Unit on Aging has worked to leverage these programs by partnering with our Aging Service Network and other state agencies, assessing food insecurity using a validated 6-item food security survey to determine those who are most at risk of hunger, and meeting all the recommendations of the first state plan to address senior hunger, including the creation of a senior hunger interagency council comprised of our sister agencies that provide critical support services to our seniors from SNAP to housing. Here are some key observations from our work in Georgia. The solution to senior hunger should be a holistic one, including relevant programs, agencies, and stakeholders. The state plan broadens the diversity of stakeholders at the table, and there's no national model of interagency collaboration in data sharing, service delivery, and program implementation for us to follow and leverage in state work. Therefore, the creation of our interagency council is a pioneering endeavor with lots of potential. Leveraging partnerships across the various sectors is critical in assessing and implementing and evaluating nutrition and aging programs, initiatives, and policies. We are proud that Georgia has been at the forefront of many of the recommendations of the White House National Strategy on Hunger, Nutrition, and Health, and we look forward to being a part of that. Thank you for the opportunity to speak before you today and share our experiences here in Georgia. Thank you.
Dr. Walker, thank you very much for your testimony and again for coming back after the first hearing had to be postponed. Our next witness is Mr. Tom Gilroy. Not sure we're hearing Mr. Gilroy's audio. Is that?
We start over again.
Yep, that's great.
Can you
Thank
hear me now?
Yep.
Okay,
Thank you.
very good. Thank you. Good morning to the Senate Committee on Aging, Chairman Casey and Ranking Member Scott. I appreciate the opportunity to testify about my volunteer at the East Cooper Community Outreach, better known in the community as ECHO. I'm Tom Gilroy. I live in Mount Pleasant, South Carolina, and my wife, Marilyn, and I volunteer at the food pantry. I also serve on the development committee. ECHO is a community-based organization that has been created out of the needs from Hurricane Hugo in September of 1989. So we've been operating for over 30 years. We serve Charleston County, east of the Cooper River, and we also serve parts of Berkeley County. ECHO supports a growing need in our community of providing food, clothing, medical and dental care, as well as financial help for utilities, rents, and other short-term financial needs. ECHO provides skills to manage money and guidance to become as independent as possible. Our food pantry allows clients to choose specific foods for their family from our real-time inventory. They receive monthly points based upon their family size. The choice is made either online or by calling our office. We limit the number of specific food types to ensure a more balanced nutritional meal. Also, once a month, ECHO hosts a free farmers market to provide local families with enough fresh fruits and vegetables for the entire household. ECHO's funding comes 62% from individuals and local business contributions, 26% from private foundations as well as business and corporate grants, and 6% from county, state, and federal funds. The remaining comes from churches and civic organizations. The USDA partnership provides ECHO with 83,000 pounds of food a year. Our clients are 78% female, 57% are over the age of 55, and 14% over the age of 70. 23% of the household with children are led by grandparents. ECHO has had an increase over this past year significantly. We serve an additional 50 families in our food pantry monthly. Distribution of clothing has increased by 43%. New medical and dental clients also increased over the previous year by 30%, and our financial assistance has increased by 9%. However, our food donations from our retail partners are down by 16%. Contributing factors are simple. Most checks don't go as far as they used to. Due to the rising cost of inflation, which translates to higher rents, groceries, clothing, and gas prices, our neighbors are turning to ECHO to help fill the gap. The best part about volunteering are the people you meet and get to know as real folks. For example, I'll call her Miss Harrison, 72-year-old woman who is in desperate need. She lived on a fixed income and she got by. But now she faces a new challenge when 3 teenage grandchildren have come to live with her and depend on her care. She told me she couldn't feed them if it was not for ECHO, and she gave me a big hug. Helping real people face real problems really makes volunteering worthwhile. The reason I volunteer is a joy we all receive from meeting neighbors and standing beside them in difficult times in their lives. Our slogan, neighbors, helping neighbors, sums it up for me. I see ECHO as an organization that's committed to their mission, is well organized, ethical, and well managed. Our team of volunteers work together like a family. It helps and supports each other in caring for our clients. Our plans for the upcoming year are to extend our reach into more rural communities that are north and west of Mount Pleasant. These communities have tremendous need and fewer resources for help. 30% of our clients live in rural communities and depend on ECHO to make ends meet. These communities are food deserts. In addition, transportation and distance create access issues. ECHO continues to serve as we see the needs arise, but it's only possible to meet those needs because of the support from our community. It's great to work with dedicated volunteers and an organization committed to serving others. It's truly what being a neighbor is about. Thank you so much for allowing me to share my experience.
Mr. Gilroy, thanks very much for your testimony. Our final witness for her statement is Elaine Masters. Elaine, you may begin.
Chairman Casey, Ranking Member Scott, and members of the committee, thank you for inviting me to testify today and for hearing the stories of people like me as you work to address hunger and nutrition among the aging population. My name is Elaine Masters, and I'm 65 years old. I was a self-employed writer-editor for 20 years and became a single mom when I divorced because of domestic violence. I live alone in Gibsonia, Pennsylvania, on the outskirts of Pittsburgh. My significant other and I spend as much time together as possible. My son and daughter live 2 hours away. My son and his wife are in Erie, and my daughter is heading to New Mexico for graduate school. My disability isn't obvious, but I have PCS, persistent concussive symptoms resulting from a brain injury. Direct care workers support me in living independently by letting me do what I safely can and helping when necessary. Because most people don't understand disabilities they can't see, I campaign for reform so others with invisible disabilities can access programs and services necessary to live fuller, healthier, and more independent lives. In 2009, the industry I worked in changed, and I found myself struggling to meet my budget. When I reached out for help from a partner to the Greater Pittsburgh Community Food Bank, they directed me to their food pantry. Surviving as a single mom meant managing a tight budget, so when business was slow, I attended the pantry to supplement groceries I purchased. I appreciated the pantry's community garden that provided fresh fruits and vegetables during the growing season. As my business gained momentum, I aspired to break free from depending on social services, yet every time I tried to manage on my own, another hiccup would occur in life, and I'd be back in the pantry line. In February 2014, my mother became ill. I spent the next 2+ years providing care for her in hospitals and in my home. I gave her a better quality of life she would have received otherwise, and I have never regretted what I gave up for her. Late on a November evening in 2015, I was exhausted and took a nosedive down my basement stairs. I bounced off of each sidewall and landed on the top of my head, sustaining a traumatic brain injury. Many of my symptoms lingered and caused a total and permanent disability, qualifying me for Medicare, Medicaid, and the Medicaid Home and Community-Based Services Waiver Program. In addition, I have Lyme disease and hypothyroidism. These conditions cause neuroinflammation that results in brain fog, flooding, and fatigue. My sense of balance is impaired, I get confused, start stuttering, repeat myself, and miss important information in conversations. Fatigue can shut me down for hours or days. Eating healthy foods is critical for me to maintain, let alone improve my health and to support my independence. I'm grateful for SNAP because I can choose my own foods. However, when I'm buying more healthy proteins and vegetables, I run out of benefits by the 3rd week of the month. Thankfully, I still have the food pantry to provide additional fresh and frozen meats, dairy, fruits, and vegetables. I love growing vegetables in my backyard. Being able to pay for the plants with SNAP is great, but I wish I could shop at locations like local garden nurseries. I'd also love to be able to buy hot meals with SNAP when I don't have the stamina to cook. It seems silly that I can buy a cold roasted chicken that's dry when I reheat it instead of a hot, juicy one. The Senior Farmers Market Voucher is one of my favorite programs because the produce is usually locally grown, organic, and fresh. Most of the markets that accept the voucher are in Pittsburgh, so my direct care workers take me since I'm unable to drive in city traffic. It would be nice if the voucher amount could be increased and it could be used toward home-delivered, community-supported agriculture or CSA produce boxes. I used to receive the senior food box once a month. It would help me if there were fewer processed foods, a little more variety, and quantities more suited to a one-person household. For example, I can't go through 2 large boxes of cereal each month. Also, the senior box is a bit heavy for me to carry. Finally, home-delivered meals have been a godsend, especially after my most recent hospitalization. While convalescing, I could grab one out of the freezer and have a quick meal. I'm encouraged to learn that the needs of older adults will receive more focus as new dietary guidelines are established so that more of us can benefit from the service. All of these programs provide invaluable benefits to older Americans. I believe that the key to improving them is to offer more flexibility, more access to healthy foods, and more efforts to reduce barriers to access, like transportation, delivery options, and easier, simplified applications. Thank you for the opportunity to share my story and for considering the needs of older adults.
Well, Elaine, thanks so much for your testimony and for being willing to tell your story. That's one of the most significant parts of these hearings, when someone is able to, as you all have in one way or another, relate your own experiences. I was going to start with questions for you, but in the interest of time, I want to make sure that folks know that on a day like today, we have senators that are in and out of hearings. For example, this morning, Senator Warnock was here with us earlier. Senator Rick Scott also was here earlier. They had to go to another engagement, another hearing. Senator Rosen is here. I'm going to cede my time to her so she can ask her questions and get to where she has to get to.
Thank you, Senator Casey, Chairman Casey, Ranking Member Scott. This hearing is so important. All the hearings in this committee are so thoughtful and relevant and important. I appreciate both of you organizing them. And I really appreciate you all for being here, sharing your stories, talking about your work and the impact it has and the needs that are really out there and what it means. It is so important, just like the chairman said, that we tell your stories and show your work, and then help us put meaning behind the legislation that we do to support everyone around the country, and in this case, seniors. And, you know, the flexibilities in meal delivery, I think it's really important, because I've heard from seniors all across Nevada about the success of the pandemic-related flexibilities of the grab-and-go meals, the drive-through options. We had drive-through options at all, maybe not all, but almost all of our senior centers, all that could. And it's been really an important way to ensure that seniors continue to receive those healthy meals that they need. And even their caregivers could be driving through with them, like I said, if they're unable to drive. So moving forward, Nevada senior centers are telling me they really want the ability to stay nimble so they can feed people. Nothing's more important than feeding people, right? And we want to provide services so people can get them where they are. So Dr. Walker, can you speak to how Georgia has approached the meal delivery over the last few years, how you've seen the drive-through option play out in your state, and how I believe making these flexibilities, some of them permanent, would go such a long way in serving our communities?
Absolutely. Thank you for the question, Senator Rosen. Well, certainly in Georgia, with the pandemic, we definitely leveraged drive-through meal options for our seniors, and also even extended that option where we turned our transportation that would bring seniors to the senior centers when they were open to then be the sources by which we could get meals out. Certainly, the seniors have, and our senior centers, as well as our area agencies on aging, have said that absolutely allowing for these flexibilities have been huge. And with all of our senior centers not being fully open, having this drive-through option is one that has definitely been of value and continues to be used still in Georgia.
Thank you. I kind of want to build on that for the other witnesses, because we've been able to use technology in nutrition, and I co-sponsored the Expanding SNAP Options Act. It was included in the American Rescue Plan. It's going to increase those online purchasing options for the SNAP program, where you could have things delivered right to your door. Maybe you don't need the 2 boxes of cereal. 1 small box is fine. We can better use those resources. And I'm pleased that through those efforts, Nevada seniors and their families have access to 15 online SNAP retailers. Of course, we need to reduce more barriers, because only 48% of eligible seniors enroll in the SNAP program. I think partially because of concerns over application process and unfamiliarity with technology. So Mr. Everett and then Dr. Walker, in the time we have left, can both of you talk about the role that we think technology can play in getting some of these healthy, tailored to that person's household options delivered right to their door?
Absolutely, Senator Rosen, I completely agree. I think it's a great question. When we have opportunities to strengthen accessibility and make SNAP a more user-friendly program, people will use it. I think we've been able to see that. We certainly saw that during the pandemic by increasing SNAP benefits that made it more accessible for folks and made the process of going through the application process a more warranted process for them to go through. But purchasing online makes SNAP inherently more accessible, particularly for folks that are still a little bit nervous about going into a grocery store with rising rates of the flu as well as COVID. So we know that our older adults certainly prefer this option. Now, increasing and simplifying the way in which they engage technology is also critical. And so ensuring, since Nevada is such a rural state in many respects, making sure that everybody has access to broadband. So all these things are ultimately interconnected when we're looking at SNAP accessibility for the older adult population.
I couldn't agree more. Dr. Walker.
Yes. So I agree, Senator Rosen, that technology has been a big part of this. I want to, I guess, take this opportunity to highlight, because of the pandemic, we had to figure out how we were going to leverage more of technology where we could. And so things like increasing access to tablets for our seniors has meant that they have begun where they might not have been comfortable, both as staff and people as seniors directly, to be able to use this system to leverage, technology in a sense to just reach out, to get nutrition education. And so now this step of now being able to access more ways to get your groceries online is one that seniors can be more receptive to. That also opens up our opportunity to work with our community partners who have been a great in-the-gap organizations for us to be able to help seniors who can't just easily navigate these services and be able to say, okay, what do you need? We'll order it for you and get it there, and are being the pickup persons themselves. So this has been huge.
Thank you very much. Thank you, Mr. Chairman. Really appreciate your yielding.
Thank you, Senator Rosen. We'll turn next to Ranking Member Scott.
Thank you, Mr. Chairman. Mr. Gilroy, you said something that I thought was spot on. The checks just don't go as far as they used to. I'd love for you to expound upon that a little bit, but can you help us understand not just the numbers, but the people who are affected by the impact of inflation and the rising prices? I'd love to hear your thoughts.
Yeah. I think what we're seeing are people that are not on these programs for life, but we're kind of filling a gap for them. Every statistic has a face, and I think that's the important piece to always consider. I think of a gentleman who is 65-year-old retired construction worker who was getting by, but his refrigerator went out, and faced with that additional cost, it caused him to fall behind on his rent, fall behind on his utilities, and he came to us, and we were able to provide food, personal hygiene items, get his rent caught up, and pay his utilities off. And it just allowed him to get out of a tough spot and be able to get back into a normal life. And he's now not using our services. And I think that's kind of our goal, is to kind of be a stopgap, an area that we can help people that are facing short-term issues and get them back on the road. And so I think he's a perfect example. And it's just, several people that we deal with on a short-term basis that we provide, a couple of bags of groceries and some cleaning supplies and some help, and it gets them through the month.
Things that Miss Masters spoke about as well as that stopgap, being able to use assistance in the fourth week of the month since the 3 weeks worked. I think that's a really important point that you made, Miss Masters, as well as Mr. Gilroy. I'd love to ask you to, maybe Mr. Gilroy, reflect on, I missed the number, I think it was 23% of your grandparents are supporting grandkids in their households. That number seems about right to me, maybe even a little higher in certain communities, but the truth is, I'd love for you to talk about the impact of that as well.
Well, I think the issue that we have is people are living on fixed incomes. They're getting by. They've figured out how to do that. But then all of a sudden, their life is disrupted by having additional people in the household and being responsible to care for them. And you know, I go back to the woman that I'd mentioned. I mean, she was getting by, but all of a sudden, here's three teenagers. I can't imagine three teenagers in a house and how much groceries they would eat. But she came to us and we were able to help them out. And I think there's a fair amount of people that we see that are facing similar issues where life all of a sudden changes for them and they don't know how to deal with it. And it's just an honor to work with ECHO to know that we're helping people out.
Thank you, Mr. Gilroy. I have one more question for you. I will say that it was 2 or 3 years ago, Mr. Chairman, when the number came out that about 49% of Americans did not have more than $500 in their savings account. So having been that American and when I was a younger adult, realizing that when your tire goes, when you blow a tire, it's not just a bad day, it is a crisis. When your refrigerator goes out, it is not just an alarming situation, it is a crisis. When you have 3 young boys move into your house, let us pray. That might be more than a crisis. That is a challenge. I know how much I ate when I was a kid. I know how much I eat now. But the truth is that so many of our nations, the American family, when they have a single incident happen, it's not just uncomfortable or, gosh, wish that wouldn't have happened. It leads to a crisis and then the domino effect that we sometimes don't really appreciate. When one thing goes down, it's a multiplier effect, and it's really hard to catch up. So hearing about the organizations that help folks catch up and get back to plateau, to a place where they can Congress moving forward as well. Mr. Gilroy, the one question I did have for you, and I thought it was an interesting concept, the point system, so that you're making sure that the folks that are benefiting from the food programs are having a balanced diet. Seconds or so, how that point system works?
Okay, well, basically, we have a navigator that will do intake for a client and determines both how many people are in their household as well as any kind of health issues that they may have. And so they're assigned a certain amount of points, and the points then are given out on a monthly basis, and they're designed so they can order directly online what they want, which I think is a big step forward, that you get what you want, not what I want to give you.
Yes.
And I think that's a very positive impact for our clients. But we also design it so that you can't just get all soda. You get so many of every different food category, so it requires you to look and order at a more balanced meal than just looking at snacks or items that might be different than that. We also look at what their health issues might be. So if they're diabetic or have hypertension, we'll design their selection. If you're hypertension, you're not going to get salted green beans. You're only going to see low salt green beans and other items like that. So it's a simplified process to make it work and do the best that we possibly can in both providing equality in food supply by the numbers of people and also provide some healthy patterns for our clients.
Thank you, sir. I love the point system, and I do love the fact that individuals may have and the impact on the choices that they make.
Thank you, Ranking Member Scott. I'll turn next to Senator Blumenthal.
Thanks so much, Mr. Chairman, and thanks for holding this hearing, because it's so important, obviously, not only to our seniors, but to everybody, to children as well as seniors. And we know that, according to Feeding America, have been food insecure in 2020 in Connecticut. It's estimated that 6.6% of older adults are food insecure during that same year, 2020. Then apparent, because that food insecurity is largely hidden, and places where people may not want to talk about it. But what I want to focus on is the sources of potential. 40% of all food goes to waste. Let me repeat, 40% of all the food produced in America is unused. Often it goes to landfills where it contributes to contamination of our air and water. It consists of vegetables or produce that is discarded by supermarkets because it just doesn't look quite right. And so they want to get it off the shelves, even though it's because it has some dark marks or some bruises. We've all eaten fruit that has some bruises. Not be same day delivery to the store. We've all eaten cheese that may have some mold on it. Cut away the mold. I do that quite a bit down in DC because I'm here only. So the challenge for America, it seems to me, is how to make better use of food that is discarded by supermarkets, by restaurants, by people from their own refrigerators who are given a food is unusable after that date when it's perfectly good, but the supermarkets wants you to think that you need to buy more of it. And I have introduced a measure called the Food Donation Improvement Act. Some of the legal roadblocks and obstacles that discourage food donations by restaurant, retailers, and others, create an opportunity for more nutritious gives us more information about what food is likely to go to waste within what period of time. And there are some companies in Connecticut that are using that technology to advise sellers. Anyone who wants to volunteer about your thoughts on that topic.
I'm happy to speak to it. Senator, thank you for your comment. You're right. Food waste is an enormous issue. Which, if you were to run the numbers, that's essentially enough to ensure people in the United States would have access to 3 meals a day. Effectively wipe out the problem if we were better able to. Exactly, it's not pound for pound. But it is a huge issue, and so we're not only creating higher rates of food insecurity because we're not better utilizing that food, we're also hurting the. One of the programs that our students run at Baylor University, where our collaborative is they recover the cafeterias in the community or on campus. They recover all of the food that is prepared but not served. So instead of it being thrown away, they repurpose it for after-school programs, for senior centers, for different types of interventions, and for students who may not otherwise have access to food. And so that's a simple way that we're able to reduce thousands of pounds of food going into landfills, and we're putting it into places that can help reduce food insecurity. So I appreciate you highlighting that issue.
Thank you. My time has expired. I thank the chairman. Or do we have another comment from one of the witnesses?
Dr. Walker?
Yes, Senator Blumenthal, I'd love to just say that, yes, we actually also have, and I guess this is the that has been helping to leverage that. But I will say From our end, one of the elements in our state plan to addressing your hunger includes food waste and reclamation. And though we're still in early stages, part of that is to make sure that we're looking at it from the senior themselves all the way up to organizations to kind of leverage that partnership. I think knowledge is power, that oftentimes what goes to waste is that we don't have those connections like Gooder, that helps to be that bridge between this is where the food is and this is where it needs to go, as far as organizations. And then, of course, that making sure that in our Department of National Resource, food waste supports is a critical part of that, so we can have sort of either a state or federal strategy to think about that, because knowledge is really the issue here, so that we can build that bridge. But I love that you're focusing in on that. It's very important.
Thank you.
Thank you, Senator Blumenthal. We'll turn next to Senator Braun.
Thank you, Mr. Chairman. Before I got to the Senate, I ran a company for 37 years, and in the last probably 10 to 15 years of it, when health insurance costs were just going through the roof, we fixed that, number one, by making the system based upon good nutrition, good living, wellness, and it was a great investment. When you look at the community of older Americans, it's even more important, especially if you've sown the seeds of good nutrition early on in life. The other thing I've noticed from serving on a school board, the state legislature, and even here, is that you got to have the right mechanism to actually put these things into play. So my first question is for Mr. Everett. We've got a entity back home in Indiana called AgriNovus, and it's a prime example of letting the private sector, where they're going to probably have a little bit better feel, has been to find out how you connect with the older American communities and be there through businesses and maybe some of your local government to reach out to them with not only news on what the best and latest is. I think my question is going to be then, give me your opinion on how do we incentivize collaboration with local government and maybe at the largest scale, state governments, to bring innovative opportunities to tackle these food-related issues directly with the older American community.
Thank you for your leadership in the space to address hunger and the way in which you helped lead the efforts with the White House Hunger Conference. We're very grateful for all of your leadership in this particular space.
You're welcome.
It's
Pleasure to do it.
Yeah, well, it's I think what we talk about all the time is that we try to marry at the collaborative research, proximity, and public policy. And so when you think about that, if we misidentify the realities of and the causes of food insecurity, then we're almost always going to develop solutions that don't work. And so Brian Stevenson says you can't solve a social problem from a distance. You have to have proximity to the problem. So I believe when you marry proximity, as you're talking about, people who are embedded in communities on a daily basis, they're experiencing it themselves, or their organizations that are addressing it on the front line. If you marry that with research, we're better able to accurately identify what are scalable solutions to address these issues. And so issue, this is not a local congregation issue, it's an all-the-above issue. So when you bring business together with government, nonprofit organizations and faith communities, even universities, that's when we see transformative change happen. And I will say one thing, that when I served on the Congressional Commission, we saw that food insecurity looked very different. Worked with the private sector and with USDA to launch a program called Meals to You, where we mailed boxes of food to children who lived in remote America, so remote that we literally took seaplanes and UPS trucks all over America to get food to kids when the shutdown happened. The same type of innovation has to be leveraged for our we have got to develop some targeted interventions, and it's going to take business being a leader in that process.
All right. Back in Indiana, I talked to so many places that are in the business of trying to get food to those most in need, grappling with not only the high cost of food through recent inflation on getting what they need on their shelves to get to the folks that need it, but probably as big an issue is how do you keep employees? How are you wrestling with that side of it when it's been difficult, especially as we've navigated through COVID and we're how you've managed through that, and are you seeing light at the end of the tunnel when it comes to the supplies, and then how about staffing as well?
Well, you know, cost is a big thing that we're facing every day, and we're always looking for access to more donations, to be perfectly honest, so we can buy food to feed people. The other issue that we're seeing, we have an army of volunteers, and I think tapping into them is a huge godsend because we don't pay them anything, and they have time on their hands, and it works out very effectively to get them involved in the process and expand their role to fill slots that we're not able to fill. You know, getting people back to work has been very difficult, and it's nice to be able to see the volunteers step up and take a role in providing that.
Good to hear that that is occurring because having stuff go up in cost is one thing. Now,
Thank you, Senator Braun. I'll pose some questions now. I wanted to start with, and I might have a little bit of extra time, but I want to start with Elaine Masters. Elaine, I want to thank you for your testimony and for, again, for traveling here to be with us, as I thank all. I wanted to start by asking you about your story that you provided by way of your testimony today. You highlighted the role that federal nutrition programs play in meeting your nutritional needs. In your testimony, you said, and I'm quoting, "Eating healthy foods is critical for you to maintain, let alone improve, your health and to support your independence," unquote. I understand that you appreciate the SNAP program, the Supplemental Nutrition Assistance Program.
I was self-employed, I was working, I would leave those funds for someone more in need. But when I became disabled, not only did I have this invisible disability, but I became part of the invisible poor. You wouldn't know that I needed support. So to have programs like this available to period of time where I struggled, do I sign up for SNAP, do I not? There were a lot of processed foods, a lot of sugars, a lot of fats, a lot of high sodium things that when I finally gave in and went on the SNAP program, I could go and buy fresh produce. I could actually, after having done a lot of research about what my body needed, I could buy the. I didn't have to worry about, what is my next, when is my next meal going to come? What is it going to look like? How is it going to hurt me or help me? So these programs have helped me to address my health needs, to feel, just a sense of comfort and a little alleviation of the stress that's involved with dealing with those topics. It has enabled me to have more energy and to focus more on healing than how am I going to just survive.
That's very helpful. And it's not based upon some analysis you did, it's based upon your own life, and that's especially insightful. I'll come back, Elaine, to you in a moment. I wanted to move to a question for both Mr. Everett and Dr. Walker. You highlighted in your testimony that federal nutrition assistance programs are essential to reducing senior hunger. This committee is celebrating the impact of 50 years of the Older Americans Act nutrition program and the release of our annual report and the committee fact sheet, as I mentioned. We also know that our nation's aging population is expected to grow exponentially, and that might be an even understatement, in the coming years, and that federal nutrition programs must be both strengthened and protected, both improved and uplifted. What have the Older Americans Act and USDA nutrition programs meant to older adults who need nutritional support? Maybe we'll start with Mr. Everett and then move to Dr. Walker.
Well, they are critical interventions. So we often cite that more than 50% of the eligible older adults for the SNAP program don't participate, but for those who do, it is a lifeline. And so I think, particularly when you're on a fixed income, when you're on a fixed income, and if you're a grand family, you can imagine what that's like for an individual who may have projected what they needed to retire on. But if they have a fixed income, and now all of a sudden, as Ranking Member Scott said, they're taking care of 3 teenage kids, it's not like they get a raise in order to do so. And so programs like SNAP, the Senior Meals Program, Congregate Meal Programs, as well as Meals on Wheels programs, are a lifeline to families who find themselves in those circumstances.
Dr. Walker?
Well, Mr. Everett talked a lot about the Farm Bill, so I'll take this opportunity to add that element for the Older Americans Act services as well, to say that there's been a great marriage in the fact that when we get seniors on services for Older Americans Act services, they are able to better leverage our Farm Bill services as well. And so even though for us, we have it in 2 different divisions, that's been a great catch in connecting our seniors once they make that first step. Just as Ms. Masters has stated, to make that choice to come forward, you start to learn about other services that are available. So that's been really huge, is that oftentimes we find if you qualify for one program, you likely qualify for others. So it's been huge to really provide a nice wraparound option for our seniors who are most in need.
Thank you, Doctor. My last question will be for Elaine Masters. Elaine, you shared in your testimony that you appreciate both fresh fruits and vegetables, and I understand you purchase plants to grow vegetables in your backyard with the SNAP benefits that you receive, and that you participate in, as you mentioned earlier, the Seniors Farmers Market Nutrition Program, and that a local food pantry has had a community garden to support participants in eating both healthy and fresh fruits and vegetables in the past. Can you share more about how you currently access fresh foods and what more can be done to ensure that older adults and adults with disabilities have reliable access to these types of products?
Absolutely. Thank you for the question, Senator Casey. The fact that I can grow some of my own foods by being able to purchase plants with SNAP is just a tremendous opportunity. I can just pick something off the vine in my own backyard. But having the Farm Bill and being able to go to a farmer's market where, things are really, have just been picked at the farms and brought to the market, allows me to have produce that's going to keep a little longer in my refrigerator, that I don't have to cook up all that day. And so that's great. The food banks supplement what I get at the grocery store. So having food bank items allows me to be a little more targeted in what I use with SNAP. And so to be able to use SNAP at a farmer's market, which we have at least one in Pittsburgh, where you can buy chips and buy fresh produce in addition to what you're using from your Farm Bill voucher, is just wonderful. Being able to shop at a variety of stores that do accept these benefits and allows me to shop around, get the best price, get the best bang for my buck, if you will, for the produce and healthy proteins that I'm buying. Being able to shop online when I'm having a rough day. Some days I am not able to get to the store, don't have a direct care worker available. And so to be able to shop online and have either things ready for pickup or delivery, it's a wonderful option. I think in terms of additional supports, as was mentioned by Dr. Walker and Mr. Everett, the cumbersome application process is difficult. Some of us just, it may be due to stress or our, age, but filling out applications can be tough and can be a barrier. Having transportation options and delivery options is key. The produce is there, the food is there. If you can't get to it, it really doesn't do you any good. So the role that deliveries can do, and possibly having through the Farm Bill a delivery option to get a CSA produce box would be absolutely fantastic. So I really appreciate Senator Casey, your work with developing new nutrition guidelines for older adults. We have different needs and we have different conditions. So that is going to be really essential in how we see food as medicine moving forward. So thank you all so much for this work.
Elaine, thanks very much. I'll turn next to Ranking Member Scott for a question.
Thank you, Mr.
Or
Chairman.
two.
Yeah, thank you very much. Appreciate that. It'll likely be one question, but who really knows at this point? But one of the things that we talk a lot about is making sure that our seniors are able to eat well. Very important part. One of the points, Mr. Everett, that I have come across and I think is incredibly important is that more than a third of older individuals suffer from loneliness. And some have suggested that loneliness is as dangerous as smoking 15 cigarettes a day. I'm not sure that we couldn't use an entire hearing on the negative consequences and impacts that loneliness is having on our seniors across the country. I'd love to dig into the information, Dr. Walker, and perhaps be able to see the increasing levels of loneliness and the increasing levels of prescriptions for antidepressants in our seniors because of loneliness. I think this is an incredibly important topic that we don't spend a lot of time on, and frankly, we probably don't even recognize the negative impact that loneliness is having on too many people in too many places, and perhaps preventable if we were able to do not only as members of Congress, but just as family members and friends and community members to stay in touch and engage with our seniors where they are, whether it's through FaceTime or in person, but look for new ways for us to bridge the gap where too many people are living alone. And that seems to be growing, Mr. Everett or Dr. Walker, in the time that I have remaining.
Thank you, Senator Scott, for the question. This is so timely to talk about social isolation. We actually just hired a team of 2 to come in with our Division of Aging Services and do a deep dive on social isolation. And this is a 2-year project to really to look at what services we offer, and that expands out from our agents in person, how critical it is to have our seniors come to our senior centers, because it's not just about the meal. That engagement with each other, with the staff, participating in the other programming is a critical part of addressing social isolation. But also looking at, as we talk about the importance of technologies and accessing that way, what roles can we use for seniors who are online, using tablets and things like that. So this is an important topic, and so we're working on trying to address how can we bridge that.
I would love to see the follow-up to whatever the 2-year study produces, please.
Oh, absolutely.
Thank you, ma'am.
Absolutely.
Mr. Everett?
Well, I appreciate the question. You know, I come from a Christian faith tradition, and so, you know, we think about Jesus saying, "I was hungry and you gave me food." Some of my brothers and sisters who come from the Hindu tradition have a passage of Scripture that says to give food is to give life. And if you think about that as a double meaning, most of the time when we are eating food, we're eating with our friends or our family members, and so you think about the double conundrum of food insecurity is oftentimes you're experiencing that in social isolation. And so I think, so when we think about interventions like Meals on Wheels, it's one of my favorite interventions that we have as a nation because you have many times volunteers in the local community providing hot meals every day to individuals who are living in isolation. My grandparents were living with early stages of Alzheimer's. We were unaware as a family that they were missing meals on a regular basis. It wasn't until their doctor identified that they had been missing those meals. And we found out when they weren't missing meals, they were getting in a car and driving to the local Sonic where they would get a hot dog. And so when they were eating, they didn't eat food with a high nutritional value. So their church sprang into action and created a Meals on Wheels program, partnered with the local community Meals on Wheels, to be able to ensure that they would have access to food on a regular basis. That type of intervention was a life-saving intervention for my grandparents and assured that latter stages of their lives were lives that were well-lived. But the issue is that most Meals on Wheels programs around the country have a very long waiting list. And so I think when we talk about seeing this growing population who are disproportionately experiencing high rates of food insecurity, one way that we can reduce social isolation as well as address hunger is to greater resource programs like Meals on Wheels so that we can get food to families who need it the most.
Thank you, Mr. Everett. I'm a big fan of Matthew 25 myself, as it relates to the good that we should do for our fellow citizens from the Jewish tradition, the tikkun olam, to repair the world. I think one of the ways that we could think about that in a different way is through the prism of loneliness, especially as it impacts our seniors. Thank you.
Thank you, Ranking Member Scott. I'm told that Senator Gillibrand want to ask a question or two virtually.
Yes, thank you so much, Senator Casey. Americans should not have to worry about where their next meal will come from. Yet in 2020, 6.8% or 5.2 million older Americans were food insecure. And in my state of New York, an estimated 7.6% of older adults are food insecure. Older adults of racial and ethnic minorities and those who live below the poverty line are disproportionately impacted by food insecurity. Food insecurity can impair nutrition, increasing the likelihood of chronic health conditions among older adults and reducing capacity for active, healthy, and independent life. I recently sent a bicameral bipartisan letter that Senator Sanders and 2 members of Congress co-led with me to appropriators requesting that the final fiscal year 23 appropriations bill include $1.93 billion in funding for older Americans, the Older Americans Act programs, and the Older Americans Act Title III-C nutrition services, which critically support the delivery of nutritious meals to older adults throughout the country. Mr. Everett, thank you for sharing some of your work in promoting affordable and healthy food. How would strong OAA funding improve Baylor's collaborative on hunger and poverty's threefold strategy for cultivating solutions to end hunger? How can strong OAA funding booster multi-sectoral cooperation.
Thank you, Senator. To begin with, I would say if one way in which this is going to have a huge impact is that families or senior adults who are grand families. So this was an issue that came up earlier, and I just want to say the importance of this particular intervention for grand families. First of all, we're trying to, if you think about the average individual at a household level and the insurmountable issues that they're trying to overcome, this particular funding, if they don't have access to transportation or limited access to transportation, this funding provides resources to get food directly to their front porches through food box programs, through Meals on Wheels interventions. And so without those supports, that is going to put an additional amount of stress on that household who's living on a fixed income, which is also going to put stress on those children who are being raised in those contexts. We know that that healthy children, need adequate access to food as well. So this particular funding package would increase resources to the individual on the local level, which would have a downstream effect not only on the positive impacts of health, but the quality of life for children that they're oftentimes finding themselves raising.
Well, thank you very much. In terms of barriers to healthy food access, a lot of older adults live with at least one chronic condition and take medications that often result in unique nutritional considerations. These conditions can create barriers in an individual's ability to access programs like SNAP and the senior farmers markets and food banks. Lack of transportation can also hinder access to healthy meals. Limited access to reliable transportation, especially in rural areas, further complicates the more than 20% of older adults who do not drive. Finally, home-delivered meal programs are challenged by long-distance costs and limited working-age population in rural communities. To help bridge this gap, 84% of area agencies on aging offer nutrition programs to better provide for older adults. To Dr. Temitope Walker, based on your experience working with Georgia's 12 area agencies on aging, how important is the role that the area agencies on aging play in assisting older adults in accessing healthy and affordable food?
The area agencies on aging are truly the backbone of the work. They know their counties and what the needs are. In Georgia, for instance, I mean, we have an interesting mix of urban and rural spaces throughout the state with 159 counties. There's a lot of diversity of need, and things are spread out, and some things are very close. And so the AAAs are a critical connection for us to be able to understand where those pockets of senior centers are, and also the other supportive placements of other organizations in those areas, and so that allows for that partnership. One of the great things for us is we have 12 senior hunger coalitions that are part of these AAAs, which allows us to invite nonprofits, for-profits, seniors, our staff, senior centers, and staff from those area agencies on aging to come together to actually understand what the gaps are, the resources and opportunities are in those different regions. So our work would not happen, really, without the work of those AAAs providing that groundwork on what's happening in those regions.
Thank you so much, and thank you, Mr. Chairman, for this hearing.
Senator Gillibrand. We'll now move to close the hearing. I'll have a closing statement. I'll turn to Ranking Member Scott. We know that in today's hearing, we heard powerful testimony about how federal nutrition programs help to combat senior hunger, senior malnutrition, as well as food insecurity. We learned about some of the challenges that older adults face when they're trying to put food on the table. Our Bipartisan Senior Nutrition Task Force Act will provide recommendations that enable the federal government to address senior hunger more holistically. However, we can and we should do more. I'm going to be introducing as well the Tools for Ensuring Access to Meals Act. This will be Senate Bill 5095, which will provide funding to the Administration for Community Living to implement the recommendations of the task force that will be created in the the other piece of legislation, the Task Force Act. We must ensure that every senior is connected to nutrition programs and services. We know that continued bipartisan work by this committee to address the nutrition needs of older adults can help build upon the 50 years of benefits provided by the Older Americans Act nutrition programs. With the right investments and the right coordination, our federal senior nutrition programs can promote health and build community among participants. Congress must continue to support programs like the Older Adults Act Nutrition Program, Senior Farmers Market Nutrition Program, Senior Food Boxes, and of course SNAP. We must also improve our efforts to streamline these programs and improve access. For example, many states, including my home state of Pennsylvania, participate in the Elderly Simplified Application Project that goes by the acronym ESAP. This program makes it easier for older adults to apply for SNAP. Because of this demonstration project and related efforts, an estimated 61% of eligible older Pennsylvanians are now enrolled in SNAP, which is higher than the national average. I'd like that number to be 100, by the way, but 61 is better than about 47 nationally. Those who are eligible and enrolled. So we still have work to do to make sure that every eligible senior is enrolled in SNAP. But we know as well that more has to be done on these programs and on these issues, and that robust and timely data will enable Congress to make more targeted efforts to enroll eligible older adults in nutrition programming. So I look forward to working with my colleagues on the committee to further improve access to nutritious foods for older adults and to support their health and their independence. And before I turn to Ranking Member Scott for his closing comments, I want to thank Ranking Member Scott for his work as a committee member, but more recently the last 2 years in this Congress as a ranking member. It's hard to believe that 2 years have gone by that fast, but I want to thank Tim for his leadership, his work, his bipartisan work, and the work of his staff, who have done such great work working with our staff on this committee. So thank you to Ranking Member Scott, and I'll now recognize him for his closing remarks.
Thank you, Chairman Casey, for your leadership on this committee. Without any question, so many Americans around the country wonder if Congress is irrevocably broken. Does anything ever happen in a bipartisan fashion? I think if you're looking for a way to see that things are not broken and that things do happen on a bipartisan path, it's here on the Aging Committee. There's no doubt that your leadership has been invaluable here, and it's a testament to who you are and the state you represent, and frankly to the land of opportunity that we call America. We have so much that needs to be done, and it's not blue or red, it's just red, white, and blue. And the more we focus on the American people, the more likely we are to find solutions that actually help the American people. I'm thankful to your staff for all the hard work that they've done over the last 2 years, and certainly my staff who's led me to where we are today, and so thankful that we both have been surrounded by such amazing professionals who are committed to the cause and who love America and love seniors in this country. Thank you to the witnesses for taking your time and bringing your expertise to the table. It certainly is a privilege to know that our country is going to be better off the more time we spend engaging with one another, the more likely we are to find solutions. I certainly want to say to Mr. Gilroy, my witness from South Carolina, thank you for your hard work with ECHO, a community organization that's really helped so many families throughout South Carolina and certainly east of the Cooper, as he said. I think the best days of America is certainly ahead of her. It will take all of us to make that a reality, but I am confident that if we focus on those issues that are impacting the American people the most, we'll find a way forward. I do hope that in future aging hearings that we do tackle the issue of loneliness in our seniors. I do hope that the day comes when we're having a serious conversation about how we deal with it, not necessarily on equal par with food, nutrition, and the challenges that we have, but certainly very close second to that reality. 50 years later, we're still celebrating the Older Americans Act nutrition program because it has been so effective. I hope a few years from now we're celebrating something new in the area of loneliness for our seniors. The more I read, the more I research, the more I realize that we have something that is sitting right in front of us that is so obvious, that we need to tackle that with the same vigilance that we have tackled the issue of nutrition. Thank you, Mr. Chairman. Happy holidays, Merry Christmas. God bless.
Ranking Member Scott, thanks so much. And I want to thank our witnesses again today, Mr. Everett, Dr. Walker, Mr. Gilroy, Ms. Masters. And I want to thank each of you for taking the time to be here to provide your expertise and your personal experiences. For the record, I'm duty-bound to say if any senators have additional questions for the witnesses or statements to be added, the hearing record will be kept open for 7 days until December 23rd. Thank you all for participating. Happy holidays. This concludes our hearing.